Hello everyone, I'm Dr. Shivani Patnaik from Doctor Institute and I'm here to tell you today how to do a quick check for your eyes at home. So we are going to do some eye tests right on your screen, which we usually do in a more comprehensive manner back at the eye clinic to test whether your eyes are okay. So first up is the astigmatic fan test. So for this test, it tells us about the shape of your cornea. For doing this test, keep the phone at reading distance from your face. Now look at the center of the fan at the red dot. Do the radiating lines look straight and clear? Do the radiating lines look fuzzy? Okay. So in normal individuals, the cornea is usually rounded in shape. But in some who have astigmatism, it is more like an egg or a rugby ball. So if the ball is facing up, then it's against the rule astigmatism. So the horizontal lines on the ball or the fan will look fuzzy. And if the cornea is like a ball put on its side, then it's with the rule astigmatism and the vertical lines will look fuzzy. The next test is called a visual field test. Now a bigger and better version and more accurate version is present at the clinics, where you put your face in the center of a machine and there is a dot which shows up in the center, and there are various dots that appear in the periphery by which we come to know how your peripheral vision is. So that peripheral vision tells us how your optic nerve health is. Glaucoma is a condition which affects your optic nerve, which is responsible mainly for your peripheral vision. Please note that this test is just a simulation of the actual visual field test that we do and not an indicator of your nerve health or whether or not you have glaucoma. So how this visual field test works is, you close your right eye and stare at the center dot on the screen. While staring at it, try not to move your eyes around a lot because then we aren't sure of whether we are testing your peripheral vision. While staring at the central dot, count the number of flashing lights you see appear like twinkling stars around the black part of the screen. In the eye clinic during the actual test, we have a remote with a button that you must press to reveal the results on a test sheet. So how many dots did you count? Check below in the description to see if you got them right. The next test is the Amsler grid test. To do this test, cover one eye and look at the screen. So you look at the central dot on the screen. All the lines must be straight and uniform. You should not see any black, distorted areas or blurred patches or even wavy lines. If you see these areas, they are called scotomas or metamorphopsia, and they appear as signs of age-related macular degeneration. Now the next test is a color vision test to check if the functioning of your optic nerve and the color cones and rods in your eyes are good. For this test, cover one eye at a time. Try and remember the number that you're going to see on the screen. First up is the plate number 1. This is the next one. How about this one? And now the last plate. So which numbers did you see? So in the first circle, we had the number 74, then we had 5, then 25, and the last one was a pattern. But did you see a number there? If yes, then that means that your color vision is affected. Please go and see your ophthalmologist. So how did you perform in all these tests? Do let us know in the comments and we'll help you out. Please understand that all these tests are not a measure of your eye health, but just a simulation of the tests that we do here to find out how your eyes are. To do a comprehensive and well-rounded examination, it is important to visit your ophthalmologist who will explain these tests to you in a better manner. If you have any questions about this video, please drop them down in the comments and we'll answer them for you. To know more about eye health, like, share and subscribe to our channel iLogs. Press the bell icon to receive notifications whenever we put out a new video. Thank you.